Hello, my name is Norma. I'm going to be a student nurse for today. How are you, sir?
Oh, not too bad, thank you very much.
Then I'm going to do my hand hygiene, provide privacy. I'm going to be doing 45 health assessment on you. Thank you so much for being willing to participate in this health history for my class. I really appreciate that. And just as we discussed before the video started, this is going to be a confidential assessment, and the video will be seen only by myself and my instructor. It will be deleted after being marked. I will be writing down the responses, and again, it will be only from my educational purposes. I have already confirmed your name, date of birth, and I will not use any identifying information in this video or on paper. We agreed before the video recording started that we are going to be referring to you as Mr. OO.
Yes.
And those will be the initials that I use throughout the assessment. We have already discussed before about my special considerations that we need to take into account for this interview. If there are any language barriers or sensory deficits or any other special requirements, and we discover that there is not at all. Also, we talked about your culture and agreed that there are not cultural considerations that need to be utilized in this interview. If in the course of this interview, we might touch areas in your life such as early life history, family history, cultural trauma. If you feel uncomfortable at any time, let me know. And please note that you are not obliged to answer every question. Just before we proceed, I want to confirm that you are my only source of information for this history, and we're doing it in person, and that you are a reliable source because you are alert and oriented and not having any cognitive impairments at this time.
You are right.
Thank you. What brings you here today, Mr. OO?
Well, I have a kind of pain on my right elbow, and I need to be assessed for that.
Could you show me where the pain is?
Yeah, this place.
Okay, thank you. Does it seem to go anywhere else?
No, it doesn't. Actually, just on this right elbow.
How would you describe this pain?
It's very dull, like kind of pain.
Tell me how severe the pain is on the scale of 0 to 10, with 0 being no pain and 10 the worst pain you can imagine.
At the moment, it's between 7 and 8.
When did this problem start?
I remember that I was fine until around maybe springs last year that I discovered this was kind of coming on and off, and sometimes just use pain reliever and it goes, but to come back again sometime later.
Is it after a day or after a week?
Well, it depends on. It's very difficult to say after which day because if I use the arm, I feel the pains more frequent. It comes more frequently with the continuous use of the arm.
Since it started, has it been getting better or getting worse?
Well, with the analgesics, it gets better, and sometimes when I use alternate cold compress with warm compress, especially cold compress, I feel much relief.
Do you have any other symptoms?
Well, remember again, the other symptom that I noticed, which was not there before, was that about 2 Sundays ago, when I noticed that the elbow was very warm, more warmer than the left, and it was a bit stiff that I could not even flex it. So that's just the other symptom that I noticed.
Have you ever had anything like this before?
No, it never happened until just that spring last year when I noticed it.
What do you think is causing this?
Well, I'm not very sure, but I know I had a fall late 2019. Maybe this could be, I don't know, but I couldn't just pinpoint what it could be.
What worries you about this pain?
Pardon?
What worries you?
Well, what worries me is that I don't want to lose my hand, because when it happened, when the pain was very worse, I happened to be a right-handed person, and my left hand could not perform things clearly as my right hand would do. So I was worried that am I going to lose the ability to use the hand or something like that.
I'm going to ask you some questions about your medical conditions and past health history. How would you rate your health if I were to give you the following options: excellent, very good, good, fair, poor? How would you rate your health?
I'm very good. My health is good.
As an adult, what medical conditions have you been told you have?
I know there was a time that my blood pressure was a bit high, but it has calmed down. That was the only time I knew I had some medical issue which had been resolved a long time ago. That's the only thing I can remember.
What over-the-counter medications do you use, and what do you use them for?
Well, I use Tylenol sometimes when I have headache and pain like this elbow. I use Tylenol. Sometimes I use this anti-inflammatory cream, by to apply it. It relieves me of the pain as well. And sometimes too, when I have some flu-like symptoms, I go to Shoppers Mall to buy some cough syrups or that kind of medication to relieve flu-like symptoms.
What about vitamin supplements or home remedies?
No, I don't use vitamin, but I use sometimes I use ginger. I love ginger. I use ginger like tea, which I drink very often. Anyway, that's why.
Besides medication, what do you use for your medical condition to promote health?
Well, I love my skin. I eat good food that I can afford. I rest when I can afford it. I go to gym when I can afford it. Yeah, take it easy.
Okay. How often do you use it?
Like the gym, before the COVID actually started, I go 3 days a week. But since the COVID started, I spend more of the time in my house just to do my usual stretch up and kind of thing.
Are you allergic to anything, and what happens when you are exposed to it?
Honestly, I'm allergic to poverty, but I know that's what we are looking for. Well, I'm not allergic to anything that I know. I eat anything I want to eat. I'm fine, and it's well tolerated in my body.
Have you ever been hospitalized, and what was it for?
Quite a long time ago, when I fractured my tibia. I think it was left tibia. I was playing soccer those days, and injury, and I was admitted for about 2 weeks. Surgery was done where they opposed 2 edges, and I was on cast for some time. Yeah.
Have you ever had a surgery? I think you've answered that question. Yeah. Have you ever had an accident? You did answer that you had an injury. Yeah. Have you ever had a blood transfusion? When was that?
I've never had blood transfusion.
Okay. What illness did you have as a child? And did you have the chicken pox or measles?
Well, back home in Nigeria, malaria was the most common illness that I had, and sometimes measles. I remember I was told I had measles at the age of 3, and maybe typhoid as well. But I can't remember. That was the most common things that were very endemic in Nigeria as a tropical country that I can remember that I had as a child.
Over the past 2 weeks, have you often been bothered by feeling down, depressed, or hopeless?
No,
Um, what about having being bothered by little or no pleasure in doing things?
no.
Have you ever had a tetanus shot in the last 10 years? And one
Pardon?
tetanus shot.
Where I had tetanus shot, that's part of employment, something, they ask you to go and have all this vaccine kind of thing, vaccination. So tetanus is part of it. What I had, yeah, I had it.
Have you had the 3 shots of hepatitis B and when?
Yes, I did.
When did you?
That was when I came to Canada. That was 2013.
Do you get influenza shot vaccines once a year? And when was the last time?
Every year I get, even last year around November or December, I got another vaccine for flu. I mean, yeah, influenza.
Thank you. Now I'm going to ask you about your family history. Has anyone in your family had an elbow pain?
Not that I remember.
Tell me about your parents.
Well, my dad is late. He passed away around July 1986, but my mom is still alive in good health as well. So,
How about your brothers and sisters?
well, they are fine. They are all in Nigeria. They're doing well.
How old are they?
Well, the youngest of them will be 34, 35 now. So, 34, and one is about 30, 40, 43, 45, and the one that's very closest to me is about 50 now.
How is their health?
Well, to the best of my knowledge, they are coping well, they are doing well.
What about your spouse and children?
Well, she's fine, and children are okay. They are almost adults now anyway, but they are doing well.
Do you have any medical conditions which run in your family?
Not that I know of, except that my grandmom used to have swollen knees or like arthritis. I remember that very well, especially during the cold, or we call it rainy season back home in Africa. So the knees will be swollen and she won't be able to walk properly. That's the only thing I remember.
Let me ask you about some specific conditions that are very common. Has anyone in your family been told that they have high blood pressure, heart disease, stroke, blood disorders, kidney disease, diabetes, and so forth?
Not that I know of.
Okay, now I'm going to ask you about your personal background. How far did you go in school, and what is the highest level of school you have completed?
Well, I didn't go to much anyway. But I completed just my PhD last year.
What languages do you speak? Which language do you prefer?
English.
Are you married, and who do you live with?
Well, I'm married, even though I'm living alone.
What type of home do you have?
Home? Well, home, I don't know exactly what you're looking for, but the home that I know I have a very big house in Nigeria, or houses in Nigeria anyway. But where I am right now is in an apartment that I just rented.
What do you do for a living? And what other jobs have you done?
Well, I'm a nurse, and I've been a nurse since decades. I've never done any other job than nursing.
How long ago was that?
It's over 3 decades now.
Do you feel any of your jobs have had hazards or risks to your health? And which jobs and what were you were the health hazards? What were the health hazards?
Well, as a nurse, you are prone to a lot of there's no job without its own hazard. But as a nurse, very in the mental health services, part of the hazard is that one can be attacked by clients when they are very violent or aggressive. Apart from that, the worst part of my hazard is that when you see your clients revolving, they get where they go home, they come back again, revolving, it make you sad, make you feel that as if you are not being helpful to them. So that's the main thing I see there.
Do you have any financial concerns about your home, food?
Well, unless you want to raise up funds for me, I don't mind, but I'm okay at the moment anyway.
Do you have any financial concerns about your health care?
No.
Do you use any tobacco products?
No.
Tell me more about your diet.
Well, even though I live outside of Africa, I still love my African meal. I make sure that at least 3-4 times a week I eat African diet. In the morning time, it's just the milkshake that I use, and I love it. Go to work, maybe have a cup of tea or a cup of coffee at work, come back again, have my African meal, and you can see you have veggies and fruits, and they are there that I use anyway.
Do you drink alcohol?
No.
Thank you. What do you do for leisure or to relax?
Well, to relax, sometimes I go to gym, but I spend in my leisure hours in the church, sing and study the Word of God together with other Christians, and watch movies in the church and at home as well, just to make sure I relax. But sometimes when I have the time, I go out with friends just to talk around and talk and chat.
What do you feel safe in your relationship? And has anyone physically hurt you?
No, I feel okay with my relationship. There's no trouble there.
Do you have a living will or health care wishes?
Well, I have a will which needs to be updated, which was written about 5 years ago precisely. I only need to update it anyway.
Have you designated anyone to make healthcare decisions for you if you are unable to do so?
Well, officially I have not, but unofficially, it's my spouse that's responsible for that anyway.
Okay. I've gathered all the information about your symptoms. I'm now going to ask you about different questions that relate to general information outside your pain.
Okay.
I'm going to ask you about the baseline function history. How is your ability to do things around the house or nearby?
Well, I'm perfect. I do everything myself, myself anyway. I don't have a nice girl. I don't even need one. So I take care of myself and do my hygiene and laundry. Yeah, I'm fine with it.
How is your ability for personal care? Do you have any? You say you don't have difficulties. How are you doing with your work? Are you having any problems there? Any problems with recreation?
I don't have problem at work, except with the COVID thing that has limited contacts. But at the same time, I'm fine. I have no problem with that.
Thank you very much, Mr. O. I want to thank you again for your time and the valuable information you have entrusted to my care. From what we have discussed, is there anything else you would like to add to what you have already shared?
Well, I don't really have anything to add. I'm okay with what I've told you so far, and I don't have any regret for it.
Having said all this, are you feeling sad, stressed, or guilty by any chance?
Well, not really, because I'm fine. I'm able to speak my mind and spill out whatever is in my mind. I'm okay with it. I'm feeling very happy.
But I noticed that the time you were narrating your family history, your voice was low and cracked. I'm wondering if you are okay or you need some emotional support.
Actually, the question actually reminded me of some, past traumatic events that I witnessed as a child. And but with time it heals. So time heals the wound anyway. So I'm okay. I'm fine. I've been able to speak out anyway. I'm fine.
Mr. Oo, thank you so much, and thank you for having you. The interview is going to end in a minute.
It's a pleasure.
Thank you very much.
You're welcome.